Welcome back to the MI Mental Podcast Doctors in Court edition. My name is Dr. Sabine Fonderson. Today I'll tackle a case with complications and controversies. I'll talk about Dr. Christopher Daniels, an orthopedic surgeon who faced accusations from a patient I'll call Mr. Blake over a series of knee surgeries gone wrong. Obviously the names I'm using here are completely made up, but the case is real. Mr. Blake's case involves a long timeline with multiple surgeries, severe complications, and accusations that paint a challenging picture of the patient-surgeon relationship. This case went all the way to court and brought up critical questions about medical standards, patient communications, and ethical decision. There's a lot to unpack, so I'll just dive right in. Let's start with the timeline. Mr. Blake was a middle-aged man with knee pain likely caused by years of wear and tear, maybe compounded by his weight. In 2004, Dr. Daniels performed a high tibial osteotomy using a Purdue plate. This is a plate that helps stabilize the bones after a surgical cut or osteotomy, and that's meant to realign the leg. And it's a common surgical procedure for patients who aren't ready for a full knee replacement. And it's important to note that back in 2004, the Purdue plate was a widely accepted method, and Mr. Blake's initial procedure went smoothly, and there was hope that the surgery would improve his quality of life. However, Mr. Blake came back for his third post-operative checkup, and x-rays showed that 2 screws in the plate had broken. And that's when things started going downhill. From the broken screws to pain complaints, Dr. Daniels scheduled a second surgery to repair this issue. And this is where we start seeing complications that eventually led Mr. Blake to sue Dr. Daniel. After discovering the broken screws, Dr. Daniels decided to replace the Purdue plate with the Tomofix plate. And during this surgery, he removed part of the damaged implant and added donor bone and antibiotics to prevent infection. Now, the surgery was intended to correct the issues, but complications continued. And soon after, Mr. Blake developed a leaking wound and he required hospitalization. This resulted in a series of infection management procedures. And Dr. Daniels used antibiotic beads to target the infected area directly and even cleaned the wound surgically. But despite these measures, the infection persisted. And over the next few months, Dr. Daniels performed multiple wound cleaning surgeries known as debridements to remove infected tissue. And each time he reassessed the patient and he hoped to save the knee joint and avoid more invasive procedures. But the infection was relentless and each surgery brought even more risks. Finally, after several attempts, Mr. Blake was transferred to another orthopedic surgeon for a second opinion. And this surgeon ultimately removed the remaining implants and infected bone. And Mr. Blake went through additional hospitalizations and procedures, eventually losing full function of his knee. Now, from Mr. Blake's perspective, these repeated surgeries left him feeling neglected and mistreated. And his main allegations were that Dr. Daniels used an outdated surgical technique, he didn't remove all the infected material initially, and failed to communicate or show empathy throughout his ordeal. Mr. Blake alleged that Dr. Daniels didn't keep him adequately informed about his options or the risks involved in each step. Now imagine going through multiple surgeries without feeling that your doctor understands the pain or frustration you're going through. And Mr. Blake also argued that Dr. Daniels didn't apologize or acknowledge any missteps, which left him feeling unsupported. And this lack of perceived empathy can often be a breaking point for patients, especially when outcomes aren't as expected. Empathy and communication are often underestimated but are crucial in cases where complications arise. Patients want to feel seen and heard, especially during difficult recoveries. This case also brings up ethical dilemmas about surgical decision-making. Dr. Daniels made a series of calls based on his experience, such as initially using the Purdue plate, but should he have opted for a different implant given Mr. Blake's condition? Well, there is no simple answer here. On the one hand, the Poodle plate was standard at the time. On the other hand, critics argue that Dr. Daniels should have anticipated the potential for complications due to Mr. Blake's weight and chosen a more robust implant. But hindsight is always clearer. Another ethical question is whether Dr. Daniels should have removed all infected bone and tissue during the initial infection management surgery. We know now that he chose a more conservative approach, intending to preserve as much of the knee structure as possible. And yet that decision ended up leading to more surgeries and prolonged suffering. So was he wrong to choose a gradual approach? Ethically, it's a tough call. Every surgery carries risks, and removing all infected tissue can mean more damage to healthy tissues, which he was trying to avoid. So after all these surgeries and repeated infections, Mr. Blake sued Dr. Daniels. In court, Dr. Daniels defended his choices, stating that each decision he made was reasonable and within the medical standards of that time. He argued that the Poodle plate was widely used in 2004 and the initial choice was valid. He emphasized that in each surgery, he made judgment calls based on Mr. Blake's specific situation and that surgery is unpredictable. The court had to weigh complex factors. Was Dr. Daniels acting within the accepted standard of care, or did he miss critical signs leading to unnecessary suffering? In the end, they ruled in Dr. Daniels' favor, deciding that while the situation was tragic, it wasn't due to negligence. And they highlighted that Dr. Daniels' methods were within professional standards. The court acknowledged Mr. Blake's pain and frustration, but emphasized that not every bad outcome equates to malpractice. This is an interesting aspect of the case, and especially that of the expert testimony. So another orthopedic surgeon testified that the Poodle plate was indeed common in 2004 and that it wasn't unusual to leave some infected material temporarily. The expert orthopedic surgeon emphasized that Dr. Daniels' choices were justifiable even though the outcome was unfortunate. And this shows how important context is. Medical standards evolve, and sometimes even the best informed decisions can lead to poor outcomes. The court relied heavily on this testimony to understand that Dr. Daniels' choice were reasonable in 2004, even if they might differ from today's standards. I'm going to break down a few key medical terms. The Poodle plate, as I mentioned, is an implant that helps stabilize bone in a knee osteotomy. It's been widely used, but it's sometimes prone to complications, especially in patients with additional risk factors like high body weight. Osteotomy itself is a surgical procedure where bone is cut to realign it, which helps in redistributing weight on a joint. This can delay or even prevent the need for a total knee replacement. However, it's not without risks, especially regarding infection. And speaking of infections, Dr. Daniel used antibiotic beads, which are small antibiotic-loaded implants placed directly in the surgical site to prevent or manage infection locally. This method is usually effective, but sometimes requires additional surgeries if the infection persists. Here are some thought-provoking questions based on today's case. First, in cases with multiple complications, how should surgeons balance between empathy and maintaining professional objectivity? Doctors walk a fine line between showing empathy and remaining objective, especially in cases where complications occur. Acknowledging patient struggles while maintaining a clear, rational approach can help build trust and clarity. The second question, how can doctors ensure they're fully transparent with patients, especially when they have to make difficult, in-the-moment decisions? Doctors can enhance transparency by explaining the potential risks and benefits for each procedure. Regular updates during recovery can also help patients understand the situation and feel involved in their care. Thank you for joining me today on the MI Mental podcast, the Doctors in Court edition. I hope you found this case insightful and learned a bit more about the complex decision-making process in medicine. As always, keep questioning, keep listening, and keep practicing with empathy. Outcomes are not always predictable, but open communication and compassion can go a long way. Until next time, thanks for tuning in and take care.